Today we have a really important ED toxicology type question. So these show up a lot on AMC exams, especially with poisoning from both drugs and different toxins. Today I'm going to go over 5 really important ones, but also mention some other important ones. So this can be a non-stop video for just reviewing toxicology for your emergency department review. So we'll get into the question. There's a 77-year-old woman. She's brought to the emergency department and she's ingested a liquid in an unlabeled glass bottle. The diagnosis is organophosphate poisoning. So it's just asking, you need to know the symptoms associated with each different type of poisoning, whether that's a drug or a toxin. So this is really, really important. So with organophosphate poisoning, you need to know that it inhibits acetylcholinesterase, and this can lead to a cholinergic crisis. So the symptoms you're going to get meiosis, constriction of the pupils, potentially bronchospasm, salivation, lacrimation, diarrhea, urination, emesis, and confusion. Okay, so everything's excreting out basically. And remember, you can remember that with the mnemonic dumbbells. The antidote for this would be IV atropine for its muscarinic effect, so that helps with the symptoms. But the kind of definitive treatment would be pralidoxime. Okay, this reactivates acetylcholinesterase. So we'll go through some of the other answer options. So we have respiratory depression, decreased consciousness, pinpoint pupils. This should straight away ring in your mind for opiate overdose. So the antidote for that is naloxone. Remember some of the different types. You can have heroin, morphine, fentanyl, oxycodone, different things like that. Hypertension, agitation, headache, hypothermia, chest pain, dyspnea. You should straight away think about a sympathomimetic, most commonly cocaine toxicity. So with that, you can use benzodiazepines as an antidote for agitation and hypertension, and also nitrates for chest pain. The next one, dilated pupils, dry mouth, tachycardia, confusion, warm skin. So this is actually this is an opposite of what we just talked about. So this is anticholinergic. So here you should think tricyclic antidepressant overdose. This can include things like amitriptyline, nortriptyline. So the antidote for this would be to use IV sodium bicarb. This would help with the QRS prolongation. And then skin flushing, hypothermia, tachycardia, diarrhea, tremors, anxiety, clonus. So you would think serotonin syndrome, most commonly SSRIs, SNRIs, MAO inhibitors, tramadol, MDMA, things like that. So here you can use cyproheptadine and also supportive care measures. So you can see from the answer options here that this would be the most likely answer. You have a really good description there of the answer. I just thought I'd quickly go over some other really important toxicology presentations in Australian EDs especially. So the most common ones are paracetamol overdose. There you would give, the antidote would be N-acetylcysteine. Remember with NAC, you want to plot it on the nomogram, and you can also give activated charcoal within an hour. Alcohol intoxication and withdrawal is really important, understanding when delirium tremens comes in, when you want to give thiamine. Stimulants, obviously we just talked about one of them being cocaine, methamphetamine, MDMA, ethylene glycol or antifreeze, which is it's commonly used in cars. So it increases the boiling point of water and decreases the freezing point. A lot of times children are the ones in questions that will ingest it. So think about the antidote for this is fomepizole or ethanol. Pesticides we talked about, and digoxin toxicity is a big one. So you will see that kind of scooped ST depression, and you want to give, it's called digibind or digitoxin specific antibody fragments. And then another common one is a beta blocker or a calcium channel blocker overdose. Here you want to give IV glucagon and high dose insulin therapy. Okay, so really important to understand the difference in the symptoms. The way I quickly like to think about it is that you look at pupil size and you look at secretions. So meiosis in wet, organophosphates. Meiosis in dry, think opioids. Mydriasis in dry, think anticholinergic. And mydriasis and sweaty or agitated, think sympathomimetic. So thank you very much, guys. Hope this question helped. If you're liking our videos, please subscribe. And if you're liking the questions you're seeing, these are from ACE, the exam. We'll leave a link in our bio for you guys to sign up. Thank you.